Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is brought to you by AACN's online nursing community forums, offering support, inspiration, and sharing of best practices online, with information available at www.aacn.org/AACN communities. Now, here are your hosts, AACN's Chief Clinical Officer Vicki Good and Clinical Practice Specialist Andrea Schmidt.
Hi, this is Andrea Schmidt, and welcome to the Voices in Nursing podcast. I'm joined today by one of AACN's guest co-hosts and nurse content strategist, Brandy Pack.
Thanks, Andrea. I'm just so excited to be here. I'm even more excited to revisit this story that just left such an impression on me.
I know I'm really excited about it after you shared the story with me, so I'm super excited for everybody to listen to our speaker today. And so that being said, today we are joined by Melinda Mayorga. She is a clinical nurse specialist whose profound bedside experience with a patient led her to define and bring awareness to a unique and often unspoken role, which is the last responder. This conversation will explore the vital care provided in life's final moments and offer insights that are likely to resonate with all of us in nursing. Before we dive in, I'd really like to ask our listeners a question. Have you ever considered yourself a last responder? So whether that term feels familiar or not, I want you to think about those moments that you've been there for a patient at the end of life or supported a grieving family. And I want you to hold that thought as we explore Mel's story and insights and see how your perspectives evolve by the end of our conversation today.
All right, Mel. Before we get started today, I would love to hear your story. And now, how did you get here and the patient that really did start it all for you?
Yes, thank you, Brandy and Andrea, for having me. I am an adult oncology clinical nurse specialist, and I work in the ambulatory area of my cancer hospital. I just happened to be up on the ICU requesting a signature, and I overheard nurses speaking about a way to organize themselves to sit with a patient who was about to be extubated. They didn't want a patient to die alone. And so I heard this exchange, and I offered to sit with the patient because ICU nurses have critical care patients and they need to be providing that critical care. But I knew that the patient had another critical care need, and that was to not die alone. And so as I prepared to walk into her room, I was given her name. Her name was Chi. And so I went in, I introduced myself to the patient. A nurse came in, told me a little bit about her, and the patient had experienced a profound bleed the early morning hours and no longer had any brain activity. And so it was determined earlier in the day by her family that she was to be extubated. Now, the family was not in town. The husband was in the northern part of the country. A son was abroad, and a caregiver was not available. So I offered to sit with her. And in the time that I sat with her, I held her hand. I hummed one of my favorite hymns. And I told her that she was a grand woman. And while I was sitting with her, a nurse came in and gave, I'm not sure what they're called, but she said something to her in her native language. And I later asked what that meant, and that she said to go in peace. And I thought that was really lovely. And so later, respiratory therapy came in and extubated the patient. Seconds later, the heart rate began to escalate, the blood pressure began to escalate, and it almost appeared that she was in distress. And so I asked her nurse to bring in some pain medication, and while she was away, Chi took her last breaths, and I was able to be with her during those last seconds, and it was for a total time of about 32 minutes, and profoundly affected by the timing and the ability to witness an individual's last moments in this experience we call life.
Oh, that story is just so beautiful, and it's just so heartwarming. Now, I feel like one thing we missed with you was your oncology background. What what is your background in nursing? Because if I remember correctly from your presentation, I think there was a goldfish funeral, maybe that.
Yes.
So it's end of life, before this experience with Chi, was end of life always an interest to you?
So, yes, I've been in oncology for a majority of my career with about an 8-year stint into emergency care nursing. And so I've had many patient exposures to patient death, and I have a keen interest in end of life, both the practical elements of care, the theories, and also this idea of last responders, which I'll describe later on. But in preparing my presentation, I realized that I have been interested in end of life from the very first funeral that I participated in, and that was my brother's goldfish. He was 7, I was 4, and we wrapped our goldfish in one of those metal Band-Aid boxes that they used to be metal, and we put the Band-Aid box on his Tonka truck, and we followed that Tonka trunk with about 50 of his Matchbox cars, and we slowly had a procession from my parents' bedroom to our backyard where we dug a hole, buried our goldfish, said a prayer, and it took about 2 hours. But that was my very first funeral that I participated in, and I have always been an individual who's very much interested in attending and honoring our dead for end-of-life rites.
Wow. I knew there was a connection there, for sure.
Yes.
I love that story. And I like how you have extended that into your, career, something that you truly have a passion for. And so after your experience with Chi, you coined the term last responder. So for those who may not have ever heard of the term last responder, what does it mean? And how would you define this role?
I was sharing this story with my brother who's in the funeral services, and he said to me, Mel, everybody talks about first responders. Nobody ever talks about last responders, and you should write about that. And I thought he was being clever. I'd never heard of that term. And I thought that that was a valuable term. And so I did a literature search, and indeed there are a few citations about what last responders are, but most of the definitions are for first responders. There is a band called Last Responders, and a lot of the work for last responders came out during COVID when the funeral industry was compressed in New York because of all the deaths. And so as I took a look at the literature and took a look at those citations, I realized that there was more to the term than I was seeing. There were certain authors that described it as dirty work. But I knew there was something more. And so my definition, based on taking care of Chi for those moments and the own care that was delivered to my mother when she had died by the care team to transport her to the mortuary, is what informed this whole process. And my definition of a last responder is a person with or without specialized training who is among the last to attend to or give care to a person who is actively dying, who is deceased, or who provides and supervises life's last rite of passage. So it's a broad definition, and that can include nurses, physicians, firemen, police officers, all elements of mortuary care workers, monument personnel, search and rescue. There's an entire list of individuals. It could be a daughter, a son, it could be a friend. And so I included all of those individuals because we often don't think of ourselves as last responders. We often don't receive training on how to respond at end of life, except if we're in patient populations where there's high exposure to death. And so I knew that there were a lot of us that were last responders, but we just didn't know it, and we just didn't know there was a term.
That is perfect. Like, you really just took all of those things together. And I know you kind of talked about your mom a little bit and that experience that you had when she passed away. Can you kind of tell us a little bit, the embalmer, and those people that are maybe outside of healthcare that really kind of fit inside that definition?
Certainly. So when my mother died, of course, you make a call to your local funeral mortuary services, and they send personnel to come and collect the body. And I'd seen this many times before in my career. I expected the same kind of care where a identification tag is placed on the decedent's toe. The decedent is placed into a plastic bag. That bag is zipped up, and then another identification is placed on the outside. That is not what happened with my mother. It was a very different experience, and it was profoundly sacred. What these two young individuals did is they waited at the door for us to motion them in, and when they came in, they proceeded to explain everything that they were going to do, and in fact told us that it would be very difficult to view the care that they would be giving, but we all elected to stay in the room. And what they did is one stood at the head and the foot of the bed, and they used the fitted sheet that my mother was laying on, and they grabbed it and twisted it ever so slowly. And as they twisted it, my mother became wrapped like a mummy in her favorite sheet, and it was beautiful. And I knew it would be hard to see her face covered because it would be the last time that we would see our beautiful mom. But it was hard, but it was beautiful and it was sacred. And then they gently moved her onto their awaiting gurney and covered her with this beautiful crimson velvet. It was the color of royalty, of religion, and nobility, which are terms that I would describe my mother throughout my life with her. And it was so unexpected. And then they asked us to walk with them and her, and we all escorted her out to the waiting car for her. And as I looked back at those moments with my mom and these caregivers, I realized that they gave us a beautiful gift of tenderly caring for her body after she had taken her last breaths. And they too are last responders because they were able to provide a very unique aspect of care that we never think about. Yet they changed what my expectations were and created a sacred moment for myself and my siblings and my mom's extended family. It was extraordinary. So those two incidences coupled together caused me to really think about a last responder, and there are many more. A monument individual who develops the monuments. I interviewed one in preparation for the podcast, and she shared some profound information. First of all, she had never heard of the term, nor did she even consider herself a last responder. And after I shared the definition, and after she told me what she does with her families, she recognized the elements of care that she could identify with as being a last responder. For example, she was able to share with me that making decisions when one is experiencing extraordinary grief are very difficult. And so she does a lot of listening. She listens a lot. She counsels individuals to pick what they want, not so much what the decedent wants, because they are the individuals that will be returning to the cemetery or area, and they are the ones that are going to be viewing this mortuary. So it really is for them. So when individuals hear that, there's almost a relief because they recognize that, yes, indeed, this is what I will be returning to. And so she wants to create that element of sacredness and peacefulness, connection and closure with her monument design.
I really like your story. I feel like I'm getting choked up over here listening to the story about your mother. And it really sounds like the work that those group of individuals did had such a profound impact on you. And it makes me think about the hospital setting. And, those individuals from the funeral home, they're distinctly trained in that. And so they really have an idea of how to make those moments very special for families. And I think sometimes as nurses, everything is so protocolized, right? And maybe there's time constraints. And how do you recommend that maybe nurses gain some of these skills or can apply some of these concepts at the bedside?
That's a really good question. I think all of our institutions, or at least most of our institutions, have access to continuing education hours regarding end of life. So that's one stop where a nurse can truly understand the practicalities of end of life, the signs of death, the care of the decedent, theories based on end of life. Then there's also elements of being a nurse who's actively caring for somebody who's critically ill and being in the moment of caring for that individual, providing interventions that are not conducive to life-sustaining elements. So in those moments when that patient does die, the nurse experiences at times grief in the moment. And so in those times, I think we need to recognize that after we've given the care and all the adrenaline that has been experienced to provide that care, then that period of time of reflection comes, and then maybe some grief can be experienced. And so one of the ways that nurses can engage with that grief in the moment is to perhaps partner with their clergy or partner with their mental health professionals to develop a time and behavioral elements to address that grief. For example, in my hospital, I've partnered with our chaplain, our mental health professionals, and our Institute of Arts and Medicine. And together we have come up with a just-in-time approach to grief so that if I'm an ambulatory nurse and I'm about to room a patient and the doctor walks by and says to me, "Oh, by the way, Mr. Sanchez died on Tuesday." Well, you've taken care of Mr. Sanchez for about 6 years, monitoring him, having him come in every 3 to 6 months or frequently, whatever the treatment plan is. And then all of a sudden, this pronouncement is given to you. So we knew we needed to address that with nurses. And so what we've done is we have videotaped our clergy with prayers that he's identified from nursing feedback, so that a nurse can put her phone to a QR code and that chaplain will speak directly to the nurse. That could be a prayer of over the room that a patient has just died. That prayer can be a prayer of loss. It can be a prayer of distress. So we'll have 6 or 8 prayers already available for the nurse to pick and choose. And if that aspect of grief is not something that the nurse identifies with, then we have the clinical component, or our mental health program director of our Care for the Caregiver program has developed clinical lessons about grief. What does grief mean? Why do we need to acknowledge grief? How can we acknowledge grief? The nurse will again be able to QR code those sessions. So it'll be like a one-on-one session with a mental health professional. And again, they can pick what they need in the moment. There'll also be a rock for the nurse to memorialize the patient if they'd like. Rock art is one of the oldest forms of communication. And so we are in the process of developing a sacred garden for our nurses to actually place rocks. Our staff, our physicians, anybody can memorialize their patient and place the rock there, and that will be opening very soon. We additionally have sacred spaces where our clergy just comes and listens, comes and talks to our nurses, and just listens to whatever stories they may have. And of course, like most hospitals, we have Code Lavender, we have Care for the Caregiver. So we do have those long-term grief support elements, but we wanted to do a short-term, just-in-time toolkit, if you will, that will also include a candle, a battery-lit candle for the nurses to light, so that if they have 5 minutes in between patients, they can have that time to themselves to reflect, to feel the emotions, to honor that individual and that relationship, and maybe begin the elements of closure. And that to me is a sacred aspect of our work, to close that relationship.
Oh, it's just so profound. I just wish that this was a thing back when I was a baby nurse. Like,
Me too.
you just don't ever forget that first patient that dies. I remember I was like a little new grad and the patient died and the little new grad coordinator came and was like, "Are you okay?" And I was like, "No, like I just talked to that person, so it was like those little things, just like that moment and all that stuff would have been incredible at the time." So I'm so glad that you've brought all of that, to fruition, because the QR codes alone, top notch. Top notch.
I
Well,
actually have a follow-up question. Oh,
sure.
sorry. I was going to say, how have the staff received this? Because this is fabulous information.
Well, it hasn't completely rolled out, but we did do a focus group of some of the video clips, and I interviewed 15 nurses, and they were able to give some really good feedback about just the videos and the vignettes that were presented. And even though there were some suggestions for improvement, overall, the videos were 100% well received. The painting of the rocks, 100% well received. Support from nursing leadership, 100%. Support from our physician champions, 100%. We know that we need to do something, and we've just thought of different elements of grief support for our nurses. One of the other things that nurses who might not be aware of are statewide nurse honor guards. Nurse honor guards are an opportunity for us as colleagues to honor a colleague who has passed that we do not know. And in that particular exercise, nurses volunteer. We dress in all whites. We have the navy blue traditional cape, and we have our nurse's hat. And we file in carrying white roses. As part of the Nurse Honor Chord, we nurses recite the Nightingale Tribute, and that was written by a nurse in Kansas, Dwayne Jaeger, and it's a poem called She Was There, and it describes elements of a nurse's path as she's caring for patients, and at the end of that poem, we ring a chime 3 times and call the nurse's name. We know that she's no longer able to respond to that call, and we officially then release the nurse from her duty as a nurse. And I have to tell you, this is a profound experience for the family of the nurse, for the attendees at the memorial service, and even those of us who participate. We feel that connection with that colleague, and we know that to not be able to answer a nurse's call light really is significant in our career. And so to be able to do this at the funeral service is truly a sacred opportunity for nurses to participate in. And you can Google that and look in your own state to see who's organizing that and get on board with that. It's really, really very beautiful.
It's that closure, that closure of the colleague nurse, the closure of the patient, the family, and all of that, it's like just such good work. But like you talked a lot about the patient itself. I know you talked about with your mom and the dignity and all of those kind of things. Like, do you have any recommendations for nurses that are taking care of patients? Like, how do you go about, respecting their dignity and making it the most meaningful experience for them as they, pass away?
So, of course, there's end-of-life care, and hopefully nurses are aware of the various cultural aspects at end of life and honoring those. And if you aren't familiar with your population base in your area, I would strongly suggest that you invite spiritual leaders from those religions or cultures to come and do in-services for your nurses so that you can be respectful. For example, when I worked at a hospital that had a high Jewish population, and if an individual died, we knew we were to not touch the body once the patient had passed until the rabbi could come and bless the body. So there are elements of care that one needs to be aware of. Secondly, when providing that end-of-life care, when your patient has passed, it really is an opportunity for us to show continued professionalism. I know sometimes we can be a little, we break the tension by having a little bit of humor, and I'm not suggesting that we don't do that, but I'm also suggesting that we recognize that this individual has led a life prior to those hospital days, and that we nurses witness something very profound. When you think about birth, there's a team of individuals around a birth. There should also be a team of individuals at the end of life because it's another passing. And I think we don't even think of it that way. We just sort of think of it as a task of body care, postmortem care, and we really haven't added those elements of sacredness to it. And so I think that we have some work to do there, that we could potentially work with our colleagues to be able to provide that for ourselves and, of course, for the patient.
Definitely. I think you really kind of solidified that kind of with Sheila, making sure that somebody was with her during those final moments. Because like you said, like sometimes you don't have a team there, so really kind of pulling on your colleagues for that is definitely, I would say, encouraged.
Absolutely.
You kind of spoke about a little bit earlier about those people that you kind of interviewed when you were doing the last responder, like coming up with that definition.
Yes.
You kind of spoke to some of them about, what would they say to an audience of nurses? Like what were some of those responses when you asked those other healthcare providers?
Yes. So I interviewed an embalmer, a funeral director, monument builder, a daughter, and a firefighter. With the exception of the funeral director who had read his, professional journals, none had heard of the term of last responders. And so as I chose these individuals specifically for their roles, and when we talked about their experience at end of life, they definitely had some very interesting feedback to give to nurses. For example, the embalmer said to me, "If you nurses can possibly do this, please remove tape from the skin, because the skin begins to decompose immediately and it makes it very difficult for me on the other end to provide that beautiful skin during a viewing." Additionally, she said, "Can you please lift up any tubes around the lips? Very difficult to remodel those lips if a tube has been left on top of the lips or the tips of the nares for an extended period of time." That would help her as the embalmer. And we never think about that. We have our policies and our procedures. We never think about that. From the funeral director himself, he said, "This is a very, very stressful time that families typically don't have any experience in dealing with when it happens with them. The death, the planning of funeral, what to do in the hospital, what the body's going to feel like, smell like, look like. This is a first time experience for so many people." And what is often forgotten is that hospitals, per the funeral director, don't call the funeral home. The family needs to call the funeral home. And so delays are often encountered because nobody has called the funeral home. So he said, "Please call the funeral home immediately, and then we can get on board." Additionally, death certificates are oftentimes signed by physicians who are not present at the death. So takes some time for that communication to get to that provider to sign that death certificates, and funeral homes cannot act or provide any care until that death certificate is completed. So it's important to ask about that with your nurses, and for nurses to be aware that that will hold up any sort of preparatory interventions for the deceased individuals.
I've been a nurse a hot minute, like just a hot minute. And I do not think I knew that, like at all.
I didn't either. And I think when I spoke to the daughter about her care of her mother, she said that hospice was involved very early. Her mother was still using a walker and was still talking. All the supplies were delivered, and it was as if they were just waiting for the mother to progress in her disease, yet the mother wasn't quite there. She said, interestingly, nobody took the time to find out whether or not the underwear that they provided would fit my mother. Turns out they provided a small. My mother is an extra large. And this happened over the weekend, and my friend lived in the country. She had no access to the means that had been provided for her. It didn't work. So if our listeners ever become hospice nurses, please check that medical equipment to make sure it works, because it put the daughter in a very tenuous position and created so much stress when that didn't need to occur. And the second thing that she said to remind nurses is that please be frank. She recognizes, and I think most people recognize, that we don't have a crystal ball, but we do recognize signs of death, and we can share those in a very professional and sacred way with our individuals to help them to prepare. We can discuss skin changes. We can discuss breathing changes. We can discuss hydration. Those are really important for our family members to hear over and over and over again. So when she read the lovely blue book that the nurse gave to her, she said it was in paragraph form. Give me bullet points. Give me something that I can refer to with sections. That's what I wanted, and that's not what I received. So patient education is really important at this time when we have a moment. Then lastly, I'll share with what our firefighter said. He said that firefighters go in with the intention of being first responders, but they never know when they're going to be a last responder. And you have to treat that person in the same respect and the same urgency. He mentioned that he does not allow his team to make any jokes about the scene, the patient, the event, from the time they're carrying that patient to the time they leave. No jokes are allowed among the team, because he recognizes that it's a sacred time and that they were there for just a moment, and somebody's lives has been turned upside down, and yet they're there for a moment to do what they need to do. Yet he recognized that even then that was a sacred responsibility, and he now believes that he is a last responder as well. He thinks of himself as a first responder, of course, but never thought of himself as a last responder.
This information is so great. And honestly, I'm sitting here thinking, where was this for the last 33 years that I've been a nurse? Again, like you said, inherently, you get your cultural competency and you get your spiritual competency every year, and you have your policies on death and dying and end of life care. But it's all of this other emotional support and other things that you've described that I just feel like, I don't know, like a veil's been lifted. It's just so, I don't know, it's very, very eye-opening. And I really, really appreciate you taking the time to talk to us and to share your knowledge and your expertise with our listeners, because I think that everybody's going to learn a lot from this.
I was wondering, before we close,
Sure.
like, Mel, would you read your definition again? The definition, that kind of the last responder's definition, so we can make sure we solidify that so like everybody knows.
A last responder is a person with or without specialized training who is among the last to attend to or give care to a person who is actively dying, who is deceased, or who provides and supervises life's last rite of passage.
That's great.
Thank you.
Mel, so much for sharing your story, helping us better understand the profound role of the last responder. And do you have a key message that you want nurses to know about their impact as a last responder?
I think number one is to recognize that you will be a last responder at some point of your career or in your family, and that it's a good idea to prepare yourself for what that will look like in your life and in your loved one's life and in your patient's life. That's number one. And number two, recognize that constant exposure to patient death takes its toll on us. And we really have to be able to address that both in short-term and in long-term interventions. I hope that these short-term interventions are something that will provide some context for you, for your listeners in their population, and spur them to bring about some interventions that they can do on their own or as in teams on their units. And then lastly, I would say that when you're in the position of being that person to spend the last moments of life with an individual, I hope that you will recognize that you are providing something that cannot be asked for, that cannot be acknowledged, and that cannot be thanked by that individual. And so I hope that your presence there provides all of that for you. I know it did for me. And I am so grateful that I was able to experience that, and grateful that I was able to share that, and for your invitation to speak to your listeners. It's been a true honor to take a look at this and to explore it more, and I hope to do more work with this in the future.
It's like, to our listeners now, we did start with that one question. We said, do you see yourself as a last responder? I know before I, listened to Mel's story, I did not. I did not see myself as a last responder, but it's definitely changed the way I view it. I might be a first and a last responder, and you're definitely going to be a last responder to somebody. So I think the work you've done is so amazing.
Thank you very, very much. One of the interesting things when I interviewed the embalmer was that she read my article, an editorial that I'd published. She read it and she said, I respect the term, but I do not see myself as a last responder. And I then was able to show a picture of my mother in my presentation, and my mother was the mother in her 70s, not in her 90s. She gave us the beauty of that mother that we hadn't seen before, the injuries and the pain. And so the word responder bothered her, because in her mind, it's you go and you do something and you provide care. And I said to her, Jerica, you did that. You went to this woman and you provided your expertise in a way that brought us back the mom that we remembered from 20 years ago, who was full of life and who was so interesting and so active. You gave that to us. That's our last look of our mother. So you were indeed a last responder. And she never thought of it that way. And she's, well, I guess I am a last responder. I said, you are a last responder because you gave us her beauty back.
Mel, we can't thank you enough. And I'm glad that you are letting everybody that's involved in the care at the end of life realize their impact that they're having on families. And it's a long-lasting impact. So to our listeners, we hope this conversation has inspired you to reflect on the significance of these moments and the sacred role that you play in them. Thank you for joining us, and we'll see you next time on Voices in Nursing. As always, we welcome feedback and suggestions, and you can contact us at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's online nursing community forums, offering support, inspiration, and sharing of best practices online, with information available at www.aacn.org/AACN communities.